I want to talk to you about giving birth in the hospital with a breech baby. The reason you're going to the hospital is a belief in modern societies that there is a healthcare system that can reduce or prevent risks from becoming problems. So when you go into the hospital, you are going to have the assessments, the monitoring, and procedures that the evidence-based practice, the guidelines to practice, the standards of care of practice that are done in your hospital, which may be a bit different than what your doctor believes or your midwife believes. And you are going into that space and you have to work with those things. Now, in 1970, when I gave birth, they were called assessments, monitoring, and procedures. And when I gave birth in 1982, they were called interventions. So back to this natural birth movement thing, because it says it all, natural birth movement. What does the word natural mean? And does it only mean those people who have low risk pregnancies and low risk births? It didn't include all of us, and you're in some ways not included in that conversation. So for people who had strong beliefs that birth was something that women just knew how to do and that we just popped out our babies. I used to hear in the 70s, well, women birthed by the rice paddy and went back up and worked. Yeah, well, they do. Women birth in the back of a taxi or on the way to the hospital or at home. We birth all over the world. But birth is not always just an easy thing. Many women suffer. It can be days before you can get a baby out. There are problems with mothers and babies. So we have to, as we've tried to say in this, get really real with you. This is what Birthing Better Families did. We got really real. Breech has risks. Head down babies have risks. Twins have risks. Everything has risks. But it's not a generalized risk. It's specific to you. So your risk is your breech baby. You may have other risks as well that compound it, but your risk is a breech baby, and some breech babies have a higher risk than others. But if you don't know your body, if you don't know your pelvis, if you don't know the shape that your baby's coming out of, if you haven't prepared your vagina, if you don't know how to work with a natural occurring pain, you're compounding the risks. And so when you go in the hospitals and they do assessments, you may not like them, but they're safeguarding you and your baby. So you have to learn to work with them, and that's what Birthing Better Families did. We worked with the assessments using our skills, and because we worked really well, and because we coped better, and we didn't look like we were suffering, we didn't look out of control, we didn't look like we were moaning and groaning, we didn't get sweaty and white and red, and our partners were going, oh my God, just get it over with, please, somebody help her. Then we behaved in a way that our obstetricians and our labor delivery nurses or midwives saw us behaving in a controlled manner. This is not what the natural birth movement says. Women shouldn't have to behave like good little girls. It's not about that. It is about our using skills to cope with what we are internally feeling and what is happening around us. So when I gave birth in 1982, my baby wasn't breech. He was 2 months premature. Is that a risk factor? Of course it's a risk factor. So I had to behave. I had to cope and manage, deal with, handle, stay on top of, feel in control. And because of my behavior, the obstetrician and the labor and delivery nurses negotiated with me about how things went. I still had assessments, monitor, and procedures. So, and there's a video in this course about my experience. So you need to understand that going to the hospital is not going to stop you from having a birth. It is going to stop you from not having as many of the assessments, monitoring, and procedures as you would in a home birth. But let me make it very clear. Midwives have a standard of care in their practice. Even if they're a lay midwife, they're going to be required to do assessments, monitoring, and some procedures. So you're going to have them done at home or in the hospital or a birth center. So what we want you to know is use your skills. If you don't like the assessments, monitoring, procedures, use your skills more deeply. Cope better. If you need to negotiate, make certain you're negotiating not from ideology, but from what actually is happening at the moment. If everything is looking fine, we discovered in the 70s and 80s and the 90s and the 2000s that when we were skilled giving birth, everybody relaxed and they were more conscious that everything's looking fine, so we're going to just let it keep going. So if you want to have a breech birth in a hospital, you want to be highly skilled and you want to be able to get that baby out as easily as possible. That's on you. You need to open up your body, you need to soften inside, and you need to work through your baby's birth effort. That's on you. They can't do that for you. What they're doing is saying, if you can't do those things, then we're going to step in and use modern medical care.